Thank you so much. And especially, I actually want to thank Vijay Thapaji for supporting us and being in the backstage and helping us out so much today to make this live possible. And also, thank you so much, Health Foundation Nepal, for supporting us as always. Namaste, everyone. My name is Mridu Upreti, and I am an incoming Army medical student. I want to thank everyone who have joined our live show event, and I am super excited about this fun. I want to quickly actually tell you about our live show today, and we'll introduce our very, very special guest soon as well. So, our live show is mainly going to focus on women in medicine, the problems we face as women in healthcare, and we will also discuss about Dr. Singh's journey in medicine and how she got matched in the US as well, which is super exciting. Um, which will motivate the youth and help them dream bigger and make their dream into reality. So let me introduce our very, very intelligent, sweet, and multi-talented Dr. Raj.
Namaste, everyone. I'm Rajri. I'm from Kathmandu, Nepal. I matched here at Philadelphia, United States, for diagnostic radiology. So I'm a first year resident physician. I'm really excited to be here today. So thank you so much for having me at your session.
Mm-hmm. Thank you so much, Dr. Singh, for taking your time out and joining us in this live event. I know that you're extremely, extremely busy with your residency and your night shifts, but still you're here and it's going to be informative. So, me and the audience both thank you very much.
Thank you so much.
Questions?
Yeah, I mean, we had to reschedule a lot of times to work out the schedule, but yeah, I'm glad this finally worked out for both of us.
Yes. And if the audience, if you have any questions that you want to ask Dr. Singh or even me, then don't hesitate to ask. So I'm going to start our question session with Dr. Singh. So Dr. Singh, could you introduce yourself real quick?
I'm Rajshri Singh. I was born and raised in Kathmandu, Nepal. I did my schooling from military school, and then I did my med school from military med school. Prior to coming here, I worked for a couple of NGOs and hospitals. I took my USMLE steps, and then I matched here. So that's just basically me and my professional timeline. But other than that, my interests includes food, music, travel, and equity to sustainable healthcare and advocacy for health education.
That's amazing. I have another question for you. So I want to ask, how was your experience being a medical Army college in Nepal and working in all the healthcare systems in Nepal? And how is that experience little different from here, residency, doing your residency here in the US?
Right. So my experience at med school, it just shaped me into who I am today. I made great friends, and I created beautiful memories that I will cherish forever. And I think of all the memorable experiences I had during my med school. Uh, Nothing beats the feeling of seeing the spark in my parents' eyes and my professors and mentors feeling proud of me when I got all my academic awards. It was like a reminder to me that how much faith people had in me and how much expectation they had from me. Because I was still not sure about where I'm heading into with this med school. I was still on a path of self discovery, but it was sort of like a gentle reminder telling me that I was heading in the right direction. I experienced a lot of diverse aspect of medicine prior to joining here residency, and that was something deliberate. I experienced about a lot of academic prospect of medicine, focusing on didactics and research when I was in med school. um, During my internship, I was more towards inclined towards focusing on the standard of care and actual application of whatever I learned during my med school, MBBS, and bringing all that textbook knowledge into life, actually practicing on patients, treating them. Um, But yeah, I noticed a little bit of disparity into what I read in my textbook and then what I was practicing in my actual OPD or inpatient. So, and to push further, what I did was I after I graduated from my med school and completed my internship, I joined the INGO, where I was working as a simulation based trainer, training rural midwives and nurses about neonatal resuscitation and postpartum hemorrhage, going from village to village. And that was another diverse experience for me, where I actually experienced how much of disparity there is in standard of care in capital versus access to a basic primary health care outside the capital. And I really did all of this to make sure, what how do I see myself in the next 50 years. I really wanted to do this, so this was a very important experience for me prior to residency. And now that I'm here in the residency, I think one of the driving factors why I wanted to pursue USMLE was to see what the gold standard of healthcare is. Like whatever I read in the textbooks, all the standard textbooks that I read during my MBBS, I actually now I'm seeing it come into life. Whatever you're reading, the latest guidelines, latest advancements, I'm getting to see a lot of them over here. That is the reason why I'm here. So I'm experiencing more and more new things every day. So this has been great. So talking about other differences that I noticed over here versus Nepal is the approach we make to patients. Back in home, I think we are used to addressing our patients as ama, bua, dai, didi. I'm like, here you kind of take, address them with their name. um, so that's something else, like the kind of professionalism we have with patients over here, all while also maintaining a good doctor-patient relationship, is something new. I notice here the patients have a lot more autonomy as to choose what uh, what they would want to do with their body, what treatments they want. They're very self-aware. Back home, I think patients, they really trust their doctors into taking decision. I think a lot of that also comes from the education level of our patients that we have over there, and a lot of times I think families have a lot more say into collective decision making for patients. So those little cultural differences are something that I notice as well. That's been an interesting experience so far.
Yeah, definitely. It sounds very interesting. And I guess every population is so different. You know, Nepal's population compared to here, it's very different. But it's really amazing how you have that experience of diversity, that experience of working in underserved areas in Nepal, and also like here, and you're also working with patients here, and there are like underserved areas here as well, and you're working there. So it's amazing of what you have done and what you will do in the future. So I want to ask you another question, which is aligns with our discussion today, which is women in medicine. And I really want to ask you, what struggles have you faced being a woman in medicine, and are these experiences, do you think, different from you being a female in Nepal compared to you being female here? How you're treated in both like nations?
Right. So yeah, talking about women in medicine, that's what we wanted to discuss a lot more about today. So I'm just glad that I'm having a say in this, putting my point of view out there, just sharing my experience, and hopefully the people can relate to my experience and reflect upon them. So a lot of times I notice as a woman is we have to work an extra mile just to prove our point, and just to come across through as compared to our male peers. So just sharing an interesting story was a lot of times I think men around me always got a lot of credit for things that I worked hard for. For instance, I was work. I just completed all my steps, and I had like 99th percentile on my steps, and people were assuming that, hey, she was in a group of highly intelligent peers, male peers, and that really helped her through. And probably which is also why she did good. So I think they completely missed the part that I was a test taker sitting in prometric for 8 hours. But and obviously when I shared this to my male peers, they were in laughter because they knew obviously this is wrong, and they completely appreciated my hard work. So it's just a subconscious perception in our society about what is expected of women that was reflected upon me. And men around me, I mean, obviously they are my friends, and I they have always been through thick and thin. I have great friends, but it's just that sometimes as a woman you would have to work a lot hard to prove yourself. Even whenever in med school I wanted to volunteer for a position of leadership in a project or some group activity, people were hesitant if I would be easy to work with, or if I could handle that, or some sort of thing. So I never took too much offense in that, but because I know where all of this is coming from, because it's deeply ingrained in our patriarchal society. And I sort of just realized that maybe after I turn one milestone after the other in my career, hopefully I would actually prove what I'm worth for. Another thing that I noticed here versus in Nepal, regarding women in medicine is, back home, I think a lot of my female colleagues, when they were deciding what they want to pursue during their internship, were often advised to choose a less competitive specialty, trying to balance family and work. And we all know what that implies in our society when we're trying to balance work and family. So, so far, finding a mentor is a challenge for me that I've struggled, that I've faced. Um, so a lot of times I had to write my own narrative, and hopefully my goal is to inspire young upcoming minds and trying to be a mentor.
Hmm. Definitely. And I think, being a female is a problem that is faced in the US as well, because when I was even shadowing doctors here, and I was shadowing this female doctor, and even the patients, they were like, oh, where's the doctor? Or like, oh, are you a nurse? And those kind of things, I feel like it's so stereotypical, and that still exists even in the US,
Right.
which is very sad, I think, because, uh, that limits us as women. And I feel like this, um, it's a very wrong thing to do. And
Yeah.
I feel like these events, addressing to, like, public, I feel like these things really help to kind of
Yeah. I
ingrain.
mean, yes, absolutely. It's all a part of gender stereotype. It's very common in Nepal also to get called female physician as sister, which actually means nurse. And I
Mhm.
always joke with my friends, like if I had $1 for every time someone calls me nurse at the hospital, I would actually pay off all my loans. It doesn't offend me because back
Mhm.
home, at least in Nepal, like a lot of patients were illiterate, so they don't read your badge or they don't understand. And with society changing, with a lot of more women coming into medicine, um, I remember when I was in med school, we had, on a ratio of 100 students, we had almost 33% female doctors, and the rest were male. So, and then eventually, as the med school went on, we actually caught up to, I think, like 40 or 55 at one point. So obviously, like, a workforce has a lot more women in it. So hopefully, over the time, maybe things would change. So yeah.
Mhm. Definitely, I agree. I feel like even in medical school here, the percentage of women is actually increasing every year, which is amazing thing that, women are entering like healthcare. And it's really good to see that. But still, there are so many things I feel like even the healthcare institute has to work with. It's not even, us as like doctors, or us as like, female. I feel like it's also some changes that the healthcare organization has to make for women, to kind of make it, because another thing is gender pay gap. And we can actually, I'll ask you, what are your thoughts in gender pay gap, and how do you think, I mean, it is something that is very tricky to even overcome, because it's a system that
Right.
is engraved in our like society and the healthcare institute. But what are your thoughts in that?
Uh, Pay gap. So first of all, it's not a myth. A lot of people think it's a myth. It's not. It exists. It's a complex issue, and I cannot speak for a lot of other sectors or other professions because of the whole intricacy of the whole, gender pay gap and like how it came into existence. But I mean, I could talk a little bit about gender pay gap in STEM and applied sciences like medicine. So I did pull up a couple of data for this interview session regarding, uh, what is the gender pay gap? How much is it? So I looked at a couple of data from Physician Compensation Report, from Medscape and Doximity, just to understand why is there a general pay gap, like what are the elements contributing to it. Women apparently work on an average like a 10% less time while seeing patients as compared to men. So men working longer hours is one thing. The other is like women sometimes, they were more deeply impacted with the pandemic fatigue because of their responsibilities at home and at work. And I think burnout was a lot more seen in women as compared to men. Women had less incentive bonuses, which is based on productivity and work satisfaction. So another thing is, men versus women. Men were choosing more high-paying subspecialty careers. So there's only like 22% women in radiology and 14% in cardiology, or 24% in gastroenterology versus 60% in PAIDS and 40% in ID or IM specialties like that. So, but having said that, even in the same subspecialty, there is a gender pay gap in surgery related fields. So it does exist, but how can we solve it? I think we're slowly striving towards it because of the whole proportion of women joining medicine increasing over the decades. And I think it starts with voicing. We need to voice this issue, just like how we did it for Me Too movement. We talked about sexual harassment in workplace, and after that, companies made strict policies to build safe working space for women. And that worked, right? Another thing what we can do is, we need protecting bodies that focus on women welfare. Like for residents, we have ACGME, and that kind of oversees our training. So, according to ACGME, we get like paid maternity leaves during our residency. But I think as an attending, it depends upon the healthcare system or your employer recruiting you, based on how their maternity leave compensation works. So it varies. So those are some of the ways where they could help address gender pay gap. And I think we need more men who are leaders in the healthcare system, program directors, chairmen, and CEOs, because they are the ones who will eventually shape the policies. So leadership is definitely important.
Hmm. I definitely agree with you, and I definitely agree that how you said, we have to raise voices and we have to break, barriers. We have to kind of. I think you also broke a huge barrier coming from, Nepal here matching into radiology, which is even here for like, for physicians here trying to match into radiology is super hard. But being international student radiology, how was your, all your matching experience? Could you tell us a little bit about that?
All right. First of all, thank you so much. Yeah, I never thought of myself matching into radiology would impact people so much. It's after that I matched, and then people started reaching out to me. That's when I realized that me matching into radiology was actually so much bigger than just my own personal, dreams and aspirations. So uh, for me, radiology started very early because I saw my dad work as a pathologist. So I was able to experience the joy of diagnostic medicine early in my med school. And a lot of important movements surrounding people that I love depended upon radiology. We detected cancer at an early stage, or saying that, oh, thank God it's not cancer. So those kind of reports, coming from radiology, played a huge role in my life. And from an early age, I loved pictures, and they definitely say 1,000 words. So I always had a niche for, um, you know, reading scans. They always intrigued me, and I always had a photographic memory. So, all of that was like hinting me towards, radiology, and that's where I saw myself for the next, I don't know, whole life. And consider me a weirdo, but I love tests. And when I matched into radiology, my one of my friends who I was studying with reminded me of a time when I told him that, hey, I would happily study for like 12 to 14 hours a day in a cubicle if someone paid me to do it. And then he reminded me of time when I said that, and that's actually going to be me sitting in a dark room, reading scans, and the whole hospital depending upon it. I think it's a really big responsibility. And I see myself promoting preventive medicine as a radiologist, and training young minds to get accessible healthcare, and you know uh, integrating radio diagnosis into primary healthcare as well. So that would be my future goal. So yeah, that's I think everything looks exciting so far. Kind of very excited to start my training this July.
Yeah, that is super exciting. Definitely, I feel like, you did break boundaries. You did not like just, you didn't seek comfort. You kind of inspired a lot of people, and I am inspired by you as well. So it's amazing what you did, and I'm sure that a lot of international medical students, in Nepal, India, every like they are going to be inspired by you, because I feel like you just have to see, oh, it's possible. Like I want to try it too. That's how inspiration and looking up to comes from. So it's really amazing that you did it. Your family are probably so proud of you. So it's great. I have another question. Have you ever, have you ever had imposter syndrome in your life? And if so, what are your like advice of, maybe getting over it, or maybe like trying to manage it? What are your advice on that?
Yes, absolutely. I had imposter syndrome. Actually, I had like two phases of imposter syndrome. So first one was during my med school, because joining NAIHS, my army med school, I was not certain. I knew like that's what I wanted to do, but I didn't know what was expected of me, right? I think the reality checkpoint for me was when I saw a cadaver on a dissection table on an anatomy lab. That's when it struck me like, oh my God, like this is real. This is getting real. But I was, I think, getting more comfortable and able to overcome it after the first ever exam I had as a first batch of my army med school. And then actually I stood first, and I was like, hey, I think I can do this. I got this. So that was the feeling I had. And after that, there was no turning back. The second time I had imposter syndrome was this year in 2021 when I matched into residency, because I interacted with a lot of talented and highly qualified and highly skilled interview candidates. And I met all the residents, talented, young, smart residents from all over the world in my program. And then I looked at myself, and uh, I'm someone who is like very self-critical. I always assess my own actions and reflect upon it. So which is why I probably had the imposter syndrome, that mixed with a little bit of culture shock, I would say. I don't know, and then a little bit of missing my home and everything. It was a very challenging time for me, but I lived through that experience, and I actually signed up for that experience. I wanted to go through all of that because I always wanted to push myself out of comfort zone, but I had to constantly remind myself, why am I here, and what I wanted to do, and what I expect out of myself. So now I think I've settled in pretty well. I'm kind of getting used to it, but I don't know. I start radiology again next year. But so far, so maybe I might get imposter again. I don't know. But so far, I've we got electives this year, and I worked with radiology, and my team is just they're so warm, they're welcoming, and everyone's super nice, and they've sort of helped me and guide me through. So I think I should cruise along the rest of the residency pretty well. And trying to overcome it, I don't think you should overcome it really, because it's a very humble experience. It taught me so much about myself when I was trying to wean myself into the new set of roles and responsibility and what is expected of me. So I think you should learn from it, and you should be able to cherish that. And next year, when new set of young med students and young residents join in your program or your med school, I think you should be empathic towards them and sort of help them kind of wean into it. So I'm like strictly against bullying and everything that happens in Nepal or India, med schools like that, because those people are already going through a lot. And then we, as we who has already been through that, I think it's our responsibility to sort of, just guide them through. So yeah, that's my take on imposter syndrome.
That is actually really amazing and unique way of like handling situation. And I feel like, if a community is welcoming and warm, that only happens because, people are warm. And I feel like that experience comes from what you deal with yourself. And if you did go through that, then you are more empathetic and more understanding. So I think it is important to go through these phases in our lives, in
Absolutely.
order for us. So these emotions, and in the future we can help other people with it. So that is, I really like the way you answered that question. um, so my last question for you actually would be, how were you like raised in your household, and were gender roles like enforced in you, upon you as you were growing up?
Um, so I had a fairly normal childhood. I was the eldest daughter of my family of five. Um, Surprisingly, you'd think, my dad being in the military, he might be all about discipline, but it was our mom. We dreaded our mom, me and my siblings. I had two younger brothers, and they are twins. We played video games together. We had our own music band. We used to like steal t-shirts from each other's wardrobe. So it was all there. But when it came to taking roles and responsibilities, I always considered myself as the older sister, and yeah, and then that was always ingrained in me to sort of be protective about my brothers. uh, so talking about a family dynamics, I think my dad being the best chef in our family speaks volumes about how things are in our household. And all of us are like fairly skilled chef, but dad beats us all on that. So I'm like blessed with a very supportive family. My dad was a government doctor, so he obviously, we weren't like very um very much into, we were like pretty middle class, but also what I'm trying to say is, even with all of that, my parents always put my education first. They invested a lot in me. Even when I was not like a very bright student, they always invested a lot in me. And they always believed that it's important to empower daughter more than the sons. And I think it really hit my ego, and then like I could really see how much they had belief in me, and that kind of really shaped me into pushing myself even more. So another thing interesting about my childhood is I was a tomboy, and I think it's a very millennial term. I think Gen Z's don't use that anymore. But I was called a tomboy. So talk about being in a gender role. So that technically means that I'm not acting as feminine. I should have been acting maybe, but I was a rebel. Um, and my parents obviously wanted me to be a bit more feminine, but not in an assertive way. They always let me be who I am. But I think at the end, I ended up picking the masculine and the feminine traits both, and that kind of shaped me into who I am, because it is reflected on my wardrobe. Like on some days, I would wear band t-shirts, and then other days I would have the most elegant dresses and studded shoe like pumps and everything. So it's a very interesting childhood that I had. But yeah, I mean, I would not use tomboy anymore. Like that's a very gender confirming, and it doesn't really imply in today's generation, because I think people are all about being individual these days.
Mhm. Yeah, definitely. And I feel like having a supportive family, having, that support from the family and not having, oh, you're a female, you can't do this and limiting, I feel like that really limits a child a lot. And
Absolutely.
my family as well, we don't have any, like I have a twin sister and that's all. And my family also, they empower us and they tell us like, you have to like dream big in order to achieve it and nothing is limited for us as well. So I think it's so important for family, for that family support. I think it's necessary.
Absolutely. Yeah. I mean, we always talk about, charity begins at home. So I think, women empowerment begins at home.
It
So
does. I definitely agree with you. And thank you so much, Dr. Singh, for taking your time out once again and, having this interview with me. And it was very inspiring. And do you have any last minute thoughts or any final thoughts that you want to share?
Yeah, this went pretty fast. It felt like we had a pretty casual conversation. And yeah, I'm glad I was able to put through a lot of ideas and opinions too. And if someone could relate with that, that would be great. And I think what my parting words would be is that we did talk a lot about women in medicine, but honestly, I would like to stress about celebrating ourselves, our identity as a woman, as a brown woman,
Mm-hmm.
as an immigrant, brown women in medicine. So it's just about celebrating the whole thing. And I speak for all the underrepresented minorities in medicine or in STEM, be it of any age, any gender, any ethnicity, any sexual orientation. I think society needs to be more acceptable of people's individuality. And by society, I mean us. We all are the part of the society, and sort of help each other bring out the best in themselves. And definitely, if you, something that I read in the Twitter was something that I could relate with, is that if you can't find a role model who looks like you, then be that role model. So
Mm-hmm.
that is something that I would like to, tell the young upcoming minds who are about to pursue medicine or any STEM related fields.
Thank you so much, Dr. Singh. That was so inspiring, and you have definitely inspired me. And I know that you have inspired our audience today as well. And thank you once again, eNepalese, and especially Vijay Thapaji, for making this possible for us. Thank you so much, and also Health Foundation Nepal. And namaste, everybody. Thank you so much for watching.
Thank you so much, Olga. I wish you all the best for your med school. I know
Thank you.
you're going places.
Thank you. Thank you so much.